All right, everyone. It is 11:10 Eastern. So we are going to go ahead and get started with our next panel discussion about outreach best practices. So I am going to turn it over to YI's very own Aurora Harris to lead us off.
Thank you so much, Mina. I hope everybody enjoyed their break and got a stretch in, something to drink, like a true Southerner. I have my sweet tea next to me. I'm really, really excited to be talking about a topic that I think is near and dear to all of our hearts and near and dear to all of the work, right? So today we're going to be talking about getting the word out, outreach best practices. I think we've been hearing over these last 2 days about the incredible opportunities that we have to really let people across the country know about the incredible savings that they can get, the incredible health benefits that they can get. And now we're just in a critical point of how do we let folks know, given the media landscape, given everything that's going on in the world, how do we kind of cut through the noise and let people know about this incredible opportunity? So joining me, I'm really, really excited, are some expert assisters that have just been rocking it when it comes to outreach in their communities. They're going to kind of talk through some best practices, ideas around how do you offer both in-person and virtual, sort of outreach. So I'm really, really excited to be joined by them and just facilitate this conversation. Of course, at the end, we will have time for Q&A. You can ask our panelists questions. So that'll also be really great. So I'm going to kick us off with introductions. Like Mina said, my name is Aurora Harris. I work right here at Young Invincibles. So excited to see all of you virtually, extending a very warm virtual hug to all of you. And thank you for all of the work you have been doing this past year and the work that you will continue to do. It is not go unnoticed, and it is just incredible. The impact you're having on the community is wonderful. I am based in Houston, Texas. I'm YI Southern Region Director. We do a lot of work to make sure that young Texans know about the ACA. We're really excited about the savings because for us, we're a non-expansion state. So low-income young people really have an incredible opportunity to see how affordable plans really can be. And so we're really excited also to hear from the panelists today around outreach ideas to best let young people know that. I am joined by Claudia Maldonado. I'm so sorry, Claudia, I probably butchered that. She has over 14 years of experience working in the nonprofit field. The last 13 have been spent navigating families and individuals through complex healthcare systems. In her current role as Associate Director for Outreach and Enrollment at the Arizona Alliance for Community Health Centers, she coordinates the outreach and enrollment programs designed to identify populations who are underserved. So let's give Claudia a virtual snap. Yay, Claudia, thank you for being here. Next, we have Jeremy Smith. Jeremy has worked for Forced Choice Services since 2015 and serves as the program director for its ACA Navigator program in New Hampshire, Iowa, Montana, and West Virginia. Wow. He and his program specialize in assisting people in learning about and enrolling in insurance options created under the ACA, including plans on the health insurance marketplace, expanded Medicaid, and CHIP for Kids. He's also spent time raising awareness on public projects through community outreach and media. Over the past 6 years, Jeremy has done over 500 media interviews and public speaking engagements on topics that include public health, expanded ACA health insurance options, substance abuse, and gambling addiction. He currently serves as an adjunct faculty with the Political Science Department at Marshall University, and he received his Master of Arts degree in Political Science and a Bachelor of Arts degree in History from Marshall University. So major shout out to Jeremy. Yay, cheers, snaps. Thank you, Jeremy, for being here. Okay. And then last but certainly not least, we have Mark Van Arnhem. He's been leading the way in ACA marketplace outreach, education, and enrollment in North Carolina since 2013. Mark is currently the director of the North Carolina Navigator Consortium, the second largest Navigator grantee among federally funded marketplace. The consortium is a network of 10 organizations led by Legal Aid of North Carolina. Mark has been in a variety of roles at the consortium, ranging from the outreach director to the assistant director and now the director. Prior to this, Mark served as North Carolina's deputy state director for Enroll America. And prior to that, Mark worked with U.S. Senator Bill Nelson.
Start it again.
Oh, it's fine. That's fine. Sorry.
Okay. Flip.
Got it. Sorry. Y'all mute yourselves. We know how to do Zoom by now. As well as numerous federal level electoral campaigns. where Mark isn't connecting North Carolinians to coverage he enjoys sitting on the beach. Yes, with his husband and spending time with his 2 dogs. Absolutely. So thank you, Mark. Snaps, claps to Mark. So if y'all haven't heard from their bios, we got some real OGs in here. We've got some people who've been doing this for years. True experts. We are so happy to have you. And hopefully after this incredible open enrollment, we will all be on the beach with our partners and family and dogs, chilling and having a good time and thinking about all the incredible people that we've enrolled. So I want to start with just asking each panelist to sort of introduce your program, really talk about the service area, the years and history of the program, the communities that you serve, and sort of a brief summary of the program outreach strategy that you're doing right now. So let's start with Claudia.
Hello, everybody. Thank you for having me on your panel today. So I am here representing the Arizona Alliance for Community Health Centers. Just briefly, we're the primary care association for the state of Arizona. And we currently have 23 members in over 175 sites that help service communities all across Arizona. We're primarily known for giving training and technical assistance to the federally qualified health centers within our state. And within all of that work, my little niche is the outreach and enrollment department. And so outreach and enrollment within the Alliance has been very fortunate in that we have been funded for Navigator work since the inception. We have been funded every single funding cycle. And so that means that we have been able to do a tremendous amount of work with our partners to get as many Arizonans enrolled into their healthcare coverage options. And that work basically expands across the entire state. The way we do our work, since we are a Navigator grantee, a current Navigator grantee, we're also a Healthy Kids grantee, so that includes doing outreach and enrollment for CHIP. We work with sub-grantees, so we subcontract our program and our work with community health centers and community-based partners. All of our partners work to remove barriers for our Arizonans, and they are specialized. We're specialized in doing rural outreach, urban outreach, working with Latino populations, working with mixed immigration status populations. So really it runs the gamut, and most of our partners and community health centers, they're experts. You know, they know their communities. They know how to get the word out. And so we're so fortunate to be working with them to enhance strategies, to ensure that people are connected. We do a lot of work within a coalition called Cover Arizona. And so that is how we also expand those hands and that help across the entire state. So we're really excited to be here and hope to share some little nuggets of knowledge with you all.
Yeah, well, I was hearing some already when you were speaking around coalition building and subgranting to organizations that can reach different communities. So I'm already hearing some nuggets already. Let's go to Jeremy.
Hey everybody, thanks for having me today. So I'm I work for a nonprofit organization called First Choice Services based in Charleston, West Virginia. And our specialty is we're really good and we operate a number of social service helplines. So like if you're driving around and you see an 800 number and it says call for help, you know, we run that for several different states. And so we realized with doing all these helplines, if people don't have health insurance, they often can't get the help that they need and the services they're calling for. So back in 2015, we applied for the West Virginia Navigator grant, and we've been operating that ever since. And you know, the funding cycle has obviously went up and down depending on what administration's been in office. And in the beginning, we did a lot of the traditional Navigator stuff, a lot of in-person events, a lot of face-to-face contact. And during the funding cuts, we had to survive. So we specialize in social service helplines. So we largely turned our Navigator program into phone help. And so we created, an 800 number, and we advertised all over the state, especially in the rural areas, that, you can still get Navigator help, call this number. And so about 90% of our work for those 3 years were helping people over the phone. And we really didn't miss a beat. We was able to help just as many people as we always did. And so we noticed a few years ago that no organization would apply to be navigators in New Hampshire, Iowa, or Montana anymore. So we went ahead and wrote a grant to be the navigators in those states and use the same model that we had made work in West Virginia by doing work over the phone. And so we've been doing that now for over 2 years, and then we was just selected to continue that work in those states. And we've changed it a little bit. We've got some sub-grantees under us in New Hampshire now so that they can provide some in-person assistance. And then in Montana, we are the sub-grantee, and we'll continue running the phone line. And then the Montana Primary Care Association will have the on-the-ground navigators there. So we've gotten really good at helping people over the phone, and it's went well, especially for the rural people. A lot of times they may have had to drive an hour, hour and a half to even find an assister in their area. So by offering that virtual assistance, we've been able to help a lot of people. And then, we can still do a lot of outreach over Zoom. I know some of us are maybe tired of it at this point after the last couple of years, but, it's been good for us because we can still present to nonprofit organizations at their staff meetings or talk to the media, whatever it takes. We can do a lot over Zoom, and we've been able to get the word out about our programs, and we've been able to still help a lot of people. And we're really excited with this next funding cycle because we've been able to bring on a lot more staff, and we're going to be able to go back to offering the in-person assistance as well that had been lacking a little bit. So we'll be going back to doing outreach events and in-person events, and then we'll still offer our phone assistance and that 800 number that people can call and get that help. So that's our organization and our programs in a nutshell.
Yeah, and I think the nugget that I took away from that, Jeremy, is that that phone assistance was really key, especially for rural communities. I think out here in Texas, we found that as well, especially with sort of, I guess you could call it like internet kind of deserts, and folks not actually having access to Zoom and being used to being on their computers and their phones. And that was a big transition for a lot of folks. And so that was a huge, huge nugget that I heard. Mark, have at it.
All right. Thank you, Aurora. I appreciate it. Good morning, everyone. I am the director of the North Carolina Navigator Consortium. We have been around since the beginning in 2013, and we have been led by Legal Aid of North Carolina since 2014. We have been a Navigator entity throughout, and we are thrilled to be awarded again this year. We, like Jeremy said, have really played with our model to make sure that it is as efficient as possible. And this model was really tested, I think, during the budget cuts that Jeremy referred to, back at the beginning of the previous administration. We went from a few $1 million a year down to about $550,000 a year, but it was really critical to us to be able to continue to run a really robust year-round program because that's what North Carolinians had gotten used to with navigators. So somehow with bubblegum and duct tape, we were able to do that, and we made it work. We did some playing with some folks' hours and just really scaled back, but it wasn't very much seen to the consumer. To the consumer, there was always still resources there, and we did that through our website, ncnavigator.net. We use an 855 call-in number that is the same across the state, where folks can call our phone number, our 855 number, and book an appointment for anything from asking questions to a navigator to actual enrollment assistance to health insurance literacy. And we do this for all 100 counties in North Carolina. So from the mountains to the coast, we've got navigators that are here to really help. I know that we kind of moved into a model that we weren't very used to during COVID. We had to pull everybody back and think really thoroughly about how we would put a model into place where folks could get assistance and feel comfortable with their assistance in light of the pandemic that was taking place. So we relied heavily on Zoom, as I'm sure is not rocket science. I know a lot of folks did, but we also relied on outreach strategies through Zoom, where we would not necessarily have consumer-facing events, but we could do partner-facing events. We could have partner summits, and we could arm those partners that were still talking to people who were likely consumers with the talking points, with the materials that they might need, so they could become foot soldiers, if you will, in this fight to help people get coverage and access to care. And we continue to do that, to this day. That's a very successful kind of tactic for us, and it's a pretty easy lift, to be quite honest. You don't have to go anywhere. You're saying the talking points that you're used to, and you're sending out materials. So it's a pretty easy lift. But this year, we're fortunate. We were awarded the entire allocation that was made available to North Carolina. There's another smaller group in North Carolina that got some funding, and we are thrilled about that. We're coordinating with those folks. But we were really able to ramp up to where we used to be, I feel like, and even have additional resources from there. One of our sub-grantees says the gang is back together and the band is back together, if you will. So we have 9 sub-grantees across the state, and we work hard to make sure that each of our sub-grantees reaches a particular pocket of individuals or a particular part of a service area. There are organizations that are better with refugees. I'll shout out CCLA in Charlotte Center for Legal Advocacy. There's a big immigrant and refugee community there, and they do that work flawlessly. There are folks that are better with rural Access East in the eastern part of North Carolina, and our friends up in Western North Carolina, Council on Aging and Pisgah. So everyone has their own skills, but we all kind of operate off the same baseline program and use the same tactics and the same messaging and the same advertising and the same website and toll-free number to really give that branding across the state, make it better known and make it more trusted. And I think that is what has made us a real trusted messenger of ACA work and really access to care across the state. If folks know if they can't qualify for subsidies and the ACA marketplace coverage is unaffordable, that we're not going to let them leave and just say tough luck, sorry. We're going to connect those folks with FQHCs or sliding scale clinics in the community who we also work hard with, who we also provide access to our connector account if they have CACs on site and they want to put their appointments up. In North Carolina, we really look at it as a wholesome picture of the entire state, and it's not just the Navigator Consortium, working for itself. We want to work with all of our partners, whether they be CACs, clinics, whatever the case may be, to make sure that we do everything to get as many North Carolinians as we can covered.
That was awesome, Mark. I think I love the idea of when folks, necessarily can't qualify, that you're ready to go with where the next local FQHC they can go to, and still linking them to services. I think that is wonderful. So you mentioned getting the gang back together. We're in a space now where there was more funding available, and we all could potentially do a hybrid model where, similar to Jeremy with the phone number and you, Mark, with the website, could be still doing things on Zoom, still doing things online, but also in person. So I guess my question for all of you would be, did you find virtual outreach as effective as in person? And if you are going to be back in person, how are you going to adjust your outreach to adhere to pandemic safety, like social distancing? Yeah.
I'll start. I will say, I think face-to-face outreach cannot be replaced. There's a connection that provides to people, especially folks that feel like they may have been left out in the past and haven't been able to access things like healthcare before. Building that trust through, actual face-to-face, not this kind of face-to-face, but actual face-to-face is really hard to replace. I will say it can be effective and, it can move people to where you need them to be, but it doesn't build the trust level as much. We're going to continue to use a hybrid model at this point, and make sure that first of all, we want our navigators to feel safe as they go out into the community. So we are making sure that we are supplying things like plexiglass screens, making sure that we talk through social distancing. If they were to have an enrollment event, make sure to talk about masking in all cases, no matter if folks are vaccinated 2-3 times, whatever, or if they're, and we're encouraging everyone that goes out, if they are going out, to please be vaccinated. I know Legal Aid, who we actually work for, is requiring vaccinations for all staff, unless they have a medical or religious exemption. So that's one way that we're working on this. But I do think that, continuing a hybrid model for those sorts of things, like I mentioned earlier, partner forums, I think that makes a lot more sense than trying to pull a bunch of partners into a room, and is actually an easier lift at this point, and will continue to be so. I think a Zoom call with partners is a lot different than trying to have a consumer-facing Zoom forum. So I think that there are still ways to be very effective virtually, but as we start to move into a more traditional in-person model, if you will, I think we just need to be very safe and cognizant of our navigators' feelings and our consumers' feelings and their safety. We want that to come first and foremost. We don't want anyone to get sick at one of our events or ever. And so we're really erring on the side of caution and leaving a lot of that in the hands of the navigators and their own personal kind of feelings about going out there. But we're encouraging folks that do feel safe to start slowly, going out to events that are outdoors and things like that. Not just heading right into a packed gymnasium or anything like that at this point, but starting small and seeing where that takes us.
Thank you, Mark. What about you, Claudia?
So here in Arizona, we very much have a hybrid model as well. And just like Mark said, there's nothing, you can't beat face-to-face interaction. That really is the gold standard when you're doing outreach. That's how you build rapport and trust. So how do you do that in a pandemic? It's difficult, but it can be done. So basically what we have done is we've done a lot of emails of reaching out with partners and, whether they're community-based organizations or new partnerships that we want to build. We've done a lot of emails, phone calls, not as much, but emails tend to work a little bit better. When you're building these bridges, it's hard. If you've already had something established before the pandemic, it's easier to maintain, obviously, because we might have that person or that champion that you can continuously connect with, but it's a little bit harder once you're in the pandemic. We don't see the virtual pieces going away anytime soon. And with our partners, since several of them are community health centers, they're in the healthcare world already. They have enrollment assisters and navigators. So they're very, very cognizant about precautions and things that they need to do, because they are seeing people face to face. They are doing some face-to-face appointments. Some of our other community-based partners, they do have hours in other locations. So they might have a partner that they work with, a school district, a community resource center, and that takes a lot more steps to make sure that both parties involved are in agreement about how to proceed with the partnership. So it can be done. I would just say you need to maintain flexibility, and you need to constantly communicate with each other to make sure that everybody feels safe and that you are ready to change if, circumstances change, or that, you have a backup plan B, if anything were to happen.
Yeah, absolutely. Safety is critical from what I'm hearing from both of you. Jeremy, I'm really curious. I know with the phone number strategy, it sounds like it was really successful. So would you say virtual outreach was as effective as it was in person? And are you planning on going hybrid as well?
So I'll echo what Mark said. I mean, virtual outreach is always, it's good, but it's never as good as being able to sit down with somebody in person or everybody being in the same room. I can tell you one of the only situations where I've seen it be more successful is that we've been able to actually get more journalists involved because we're using Zoom. And before the pandemic, it was very unlikely that a TV journalist wanted to talk with you over Zoom. So you might have to schedule your whole day by traveling 3 or 4 hours to another part of the state to go to their office and sit down with them. Using Skype or Zoom was just almost unheard of. Now it's the norm. So a journalist in another part of the state, they are much more likely to work with you and do a story on your program through Zoom now. They know how to use it. It's just part of their everyday. So we've actually been able to get a lot more statewide media coverage because of Zoom. And so that's been great. And, even press conferences, we can hold a press conference over Zoom now, and journalists all over the state will attend rather than just the city that you were doing it in before. So that is one thing that I'll encourage everybody to go ahead and still try to do media outreach, but members of the media are going to be more likely to attend now that we're using Zoom. And then the other thing that we're thinking about, we're definitely going to use a hybrid model, and we are going to offer in person. Kind of like Mark said, it's going to depend on how comfortable the Navigator is with it. But one of the things that we've been talking about is trying to book these in-person appointments in larger rooms. So a conference room, perhaps. And what we've decided is a lot of the TVs nowadays, you can use something like Google Cast, something like that. And so you might sit on one end of the conference table and they'll sit on the other beside the TV, and you can actually cast your computer screen onto the TV. So they can sit there and follow along with you, clear on the other side of the room, and you can maintain that social distancing. So that's one of our plans, is anytime we try to do in person, we're going to spread out as much as possible and try to cast our screen onto another device that they can sit in front of. So that's one of our plans. And then obviously, we're going to be wearing masks if we're doing this. And, we have done some outdoor stuff. Any chance we get, we'll do outdoors versus indoors. But I know that isn't always available, especially if you're in a colder state. So that's just a couple of the things that we're planning on. And then, of course, we'll continue to do our phone enrollments for anybody that's not really comfortable meeting with us in person.
Awesome. Yes, that's great. We can't forget the states where it gets really, really cold. That outside might not be ideal. I love that casting idea. That's very creative. Thank you for that. So all of you, when you were mentioning your programs and strategies, emphasized partnerships, whether it be your, sub-grantees, FQHCs, many partnerships. And I think a lot of us are wondering, what are some strategies for establishing new partnerships, and how do you grow and maintain these relationships?
I think when you're establishing partnerships, you really have to do your homework. You definitely want to be strategic, thinking about resources. I know Mark had mentioned at one point you were, you had enough funding, your reach, was good, and then the funding can go down. Same thing happened in Arizona. We were doing fairly well, and then our funding went down significantly. So how do you maintain that same level? I would say that you have to be strategic with the resources that you have. So really think about, and using resources in that, look at maps, whether you have maps that tell you how many people are uninsured or potentially Medicaid eligible or CHIP eligible. Using data is very, very effective. We've had some maps here in Arizona that have told us, by zip codes in certain parts of the state, very helpful. I would say you also need to look at websites before you start just calling or emailing people. Look at people's websites, look at what their mission is, what their work, does it is aligned, are they going to have a funnel of people that are the target population that you're trying to reach. I would also say that something that's really easy to do, you can even look up the school districts in your area and look at how many of them are participating in free and reduced lunches. That is great information to have to see who might be potentially eligible for Medicaid or CHIP, and then based on strategies around that. So those are just, some of the thoughts that go into the processing of when you're going to approach a partner or, put together some sort of outreach plan.
I love that. You got to do some data mining, do your homework. I love that. Yeah. Mark?
And I will say one thing that has served us well in North Carolina is we have a core group of folks that have been meeting since day one back in 2013, a coalition of folks that are assisters, navigators and CACs, hospital associations, insurers are at the table there, and it's brought together by NC Get Covered is the name of the group, which is brought together by CareShare Health Alliance. And that's been really critical to making sure that we identify the right partners. So having a coalition that meets regularly and speaks about the issues that are currently in front of them, or just gives updates on what your organization is doing is really critical. That opens lines of communication that might not have existed before. And each of those additional organizations, they have, fingers out to other organizations that they can connect you to. So that has been really critical. Beyond that, that larger statewide coalition. In North Carolina, we have what's called an Aca Brain Trust. And I think that might be a misnomer because there's only a few cells in some of that brain trust, I feel like sometimes. But we have an Aca Brain Trust. And these are folks, it's a leader from the Community Health Center Association. It's myself and the Consortium's Assistant Director, Nick Riggs, and folks with NC Get Covered. And we get on a call probably 2 or 3 times a week, or 2 or 3 times a month, rather, a week, 2 or 3 times a month. And we discuss kind of strategy and where we should go next and what we should kind of be focused on uniformly as a state. And again, I think that really leads a lot of credence into what we're doing, because the Community Health Center Association and their FQHCs and NC Get Covered and hospitals and clinics are all kind of speaking from the same playbook. And it really gives an added level of trust to the consumer and to new partners that you reach out to, because they are feeling like everybody is giving them the same messaging. And so this is obviously something that's real and something that's valid and something that's helpful, which, even the most educated consumers and partners among us, we have all run into folks who are like, oh, I thought the ACA was gone, or it's unaffordable, or anything like that. And the more folks that you have in trusted positions around the state that are pushing the same messages and staying on message is really critical to both building your partner base and their trust. And continuing to refine that partner base and their trust, and identifying new consumers from there.
Awesome. Jeremy, did you want to go?
Yeah, definitely. So I'll mention a couple things. I mean, one of our main partners that we look for, any kind of an organization that is doing what's best to try to take care of the consumer as a whole. So although insurance may not really be on their radar, they're trying to do what's best for the people that they serve. So we always try to get in front of any type of nonprofit organization or in any medical provider, anybody that's trying to do what's best for their patients, and make sure that they know about this service. And for us, one of the things that we've tapped into that's been a great resource for us is we try to approach any and all other social service helplines. So We want to make sure that the state's suicide lifeline knows about us, or if there's a mental health helpline or a substance use disorder helpline, gambling addiction helpline, 211, obviously. So really any kind of a helpline that your state runs, the people that's doing that kind of work, it's going to be in their mission to make sure that they're doing what's best for their callers and that they're linking them up with programs that's going to be beneficial to them. So we make sure that we talk to all those types of groups. And one of the things that I've done, Mark mentioned this a little bit, people will still question, well, I didn't even know the ACA was still a thing, or I thought it wasn't affordable, or to be honest with you, sometimes health insurance just isn't sexy enough to get a meeting with the right person. So what I do is I use our other programs to get in the door. I'll make sure that I throw around, hey, we answer West Virginia's suicide lifeline. Nobody's going to tell me no if I tell them I want to come talk to you about all of our programs. And then after I get in the door, I make sure I really start hitting, this is what our insurance enrollment assisters do, and this is why it's beneficial to you. So sometimes you just have to get through the gatekeeper to get the meeting with the right person to make sure they understand why it's important that we partner together. So, I have no qualms making sure that I say, we're a nonprofit organization. We help people with substance use disorder. We answer the suicide lifeline. We help with gambling addiction, and that really helps, get me in the door. And then I can also start talking about health insurance. So I'll just mention, if your organization has other programs that it does too, and you're having a hard time getting meetings, use that as well to get yourself in the door so you can talk about it.
Awesome. Go ahead, Mark.
I wanted to just add something to helping to get your foot in the door. And this is both on the consumer and the partner side. I think it's really critical that your Navigator staff, your leadership, whatever the case may be, whoever's talking to, whether it be a partner or a consumer, really uses their personal story. A lot of folks have a personal story that connects them to this work. And that can really open doors like nothing else. I use my personal story on a regular basis when I talk to folks. And I think that was something that we all leaned into very early in this process, but we've kind of pulled back on that. And that your personal story can bring that, Jeremy used the word, it's not sexy enough, but it can bring that appeal back to the forefront. I had a dear friend of mine for years and years and years who was a personal trainer, and she owned her own business and she did very well for herself, and was the picture of perfect health. I don't think she ate anything that ever had a piece of fat or anything in her life. That was really boring for her. But she one day found a lump in her breast and went to the doctor, found out it was pretty advanced breast cancer. And she did not have the means to get health insurance at that point. There was a thing called pre-existing conditions. There was no subsidies. While she made a great income, into the six figures every year, she couldn't afford the prices that were out there, and therefore she couldn't access the care that she needed. At that time, I worked for a U.S. senator, and I sat with her on the last night that she was alive, and she said to me, "We're supposed to live in the greatest country in the world. Why is this still happening? Do whatever you can to make sure this doesn't happen to anybody else." And I know that we all have stories like that keep us motivated and keep us moving, and that we dig down deep into when we are tired and exhausted. And I ask you all to think about your personal story and find that again and refine that personal story and be ready to tell it to folks, because not only will it spur partners into action, it will spur consumers into action, and you are saving lives when you do this work, and it's nothing short of that. I cannot even tell you the number of consumers that I can think off the top of my head that have come to us and then a month later found they had a brain tumor or some sort of condition that they were able to get help with, and that they credit us for saving their lives. So I know each and every one of you on this page has a story just like that. So think about your personal story and what, drives you, and be sure to share that with folks, because that will not only make you relatable to your partners, but really show the importance of your work. It makes you relatable to consumers and really helps them to realize the peace of mind that comes with quality, affordable healthcare.
Thank you so much for that, Mark. And thank you for doing this work in honor of her memory. That's beautiful. And you kind of got to my next question, which was actually around messaging. And I definitely agree with you about personal stories, and storytelling is so, so powerful. But really quick, if other folks, Claudia or Jeremy, maybe want to talk about any messaging that you find has been resonating with partners or the communities that you serve. And if the new extended deadline is going to impact your outreach and messaging at all.
I would say, as far as messaging goes, I think you have to be really conscious of who you're reaching out to. So if you're framing, it's all about framing. I think framing a message to a school counselor may look different to a social worker, may look different to promotores in your community. So I think your messaging really has to, you have to tailor it. You're a tailor at that point, and see, you have to look at the communities that you're reaching out to and what, their culture, their values, their beliefs. If you're working with somebody who Western medicine is not maybe top of mind, but they also have maybe some traditional medicine from where they come from, you're going to tailor your message to, maybe bring both those two worlds together to talk to them about health insurance. So I think your messaging, you really have to sit and think about who and what you're hoping to achieve, and then framing it and going from there.
I love that. Thank you, Jeremy. You have anything to add?
Yeah, so obviously, it's different for every state, but one of the messages that we've been using is, just all the changes that we've seen over this past year. I mean, the ACA is stronger than ever. And so what we saw in some of the states that we operate is, around 2015, 2016, we saw enrollment peak. And then the last 3-4 years, we've saw it come back down pretty significantly in some cases. And so one of the messages that we've used is, even if you've checked into ACA coverage in the past and you didn't enroll for one reason or another, you really need to check again, because this is a big deal, the changes that have been made. In some cases, the prices are more affordable than ever, and people that have never qualified before now qualify. So we made sure to hit all those messages to convince people to come back and check into it again. Because what I had heard over and over again was, that's not affordable, I'm not doing that. But, that may have been 3 years ago when they checked into it. So we're really trying to play up some of the changes that have occurred over the past few months and make sure that we convince people they have to come back and check again, because they're going to be very happy when they look this year. So we're making sure that we're hitting those messages hard.
And then I think among the deadline, the extension of the deadline, I think that there this special open enrollment period, or this SEP that we had that lasted almost a year recently, has kind of muddied our urgency message. I know that all of us talked about, get enrolled, you have X amount of time to get enrolled. Unless you have a life event, you're not able to get coverage at any time. So I think that all of us really need to get together and think about how we kind of drill into people's heads that sense of urgency, because I think a lot of folks now have that feeling, well, I can kind of enroll whenever I want. So I don't need to enroll until I need to enroll. And that's not how the system works. And we all know that that's not how, marketplaces work. So I think that sending that message that, now we can go to November 1st through January 15th, and these are your times to enroll. I think that has to be really critical. Of course, I'm grateful for the extra month. I think that's fantastic. We don't lose all that time in Thanksgiving and all that stuff. We get that back, which is great. But I feel like we have to really drill home that sense of urgency again or else there's going to be a lot of people that are, reaching out to us in April or May saying, oh, I'd like to get enrolled now, and they're not going to be eligible because, they haven't had a certain life event, or they may not fall into any SEP category that would be applicable that would allow them to enroll. So I think really that sense of urgency is critical in messaging this year more than ever.
Yeah, absolutely. I didn't think about it like that, losing that urgency message with that very long SEP that we have, but I think you're absolutely right. And Claudia, you touched on this a bit earlier, but in terms of messaging, we're thinking about communities that we serve that might face additional barriers to coverage. I know many of you mentioned refugee communities, immigrant communities, rural communities. Can you maybe talk about, all of you, what you find effective when conducting outreach to these specific communities that maybe have additional barriers to coverage? Any partners that you found particularly helpful, and if there are other messages that might resonate with this community versus another?
Well, I think when you, especially here in Arizona, we have a really large, Latino population, and a lot of them, you have to think about how people consume information and the channels in which they consume their information. So not all communities are going to consume it the same way. We have some communities in rural parts of Arizona where there's a very well-known radio station, and people tune into that radio station to hear what's going on in their community. And these are communities that are Latino, you have mixed immigration status, families. So that is how people consume information. I would say, especially with Latino populations, radio is huge. There's a huge radio population. That's how they consume their information. So for us, it's really critical to work with some of those radio stations to get messaging out, as well as with some of the other larger TV stations like Telemundo and Univision, because people tune in. That's how they're tuning in to get their information. So employing some of those tactics in your messaging and in your outreach are really helpful. They can be expensive, obviously, and sometimes cost prohibitive, but in the instances in where you are able to do it for certain communities, it can be very well received.
Awesome. Definitely thinking about different media partnerships in which communities are looking at different media partnerships is really key. Yeah. Jeremy or Mark?
And I again think this is where you really need to partner with trusted organizations, partnering with, I'll just name a few of the folks that we partner with. International House in Charlotte that works with refugees and different immigrant communities. The Center for New North Carolinians in Greensboro. I think it's really critical to identify groups that have a lot of trust within those communities. And partner up with them and do things together, and be there, whether virtually or in person, with those folks. And they give you a lot of, they give you some real kind of trust from those folks. A lot of immigrants and folks that are not from here, or maybe refugees or whatever the case may be, they automatically are a bit distrustful and a bit leery. They're worried about things like the public charge and things like that. And we have to partner with organizations that they have a lot of trust in, and that they go to for a bevy of other things. And so we work with those organizations really closely. And have groups like that are part of the consortium as well. For example, a new member of the consortium this year is NC Field, and they are navigators now, and they work with the migrant farm worker community in North Carolina. And so even bringing them into the sub-grantee level is a great idea. But if you can't do that, just make sure that you're partnering with them, you're keeping lines of communication open, you're calling them just to check in every now and then, you're letting them know what's new and what's important, and making sure that any event that they have, you're able to piggyback on. And I think that is really, really critical with getting the trust of folks that may be immigrants or refugees or whatever the case may be there.
So I've got three things to add. I've noticed that a lot of times when we're trying to help some of the more vulnerable communities, phone and virtual doesn't go as well. It does a lot better to make sure that you're putting it out there that they can come in and see a person, and they can meet with somebody and talk, because they may be a little bit more leery. And so they want the whole story. And so it really does help by advertising that, you know, we do have in-person assistance, and, you know, it's a free program. We'll talk to you about your options. So that's one of the things that we try to do. The other is around some messaging that we use. More often than not across the board, but definitely with some of our more vulnerable populations, I try to target my messaging to moms and grandmas. It sort of just seems like they're going to do what's best for their family. They're in charge. You know, they need to make sure that they push their family members to go get that appointment. And, you know, hey, the deadline's coming up. Did you sign up yet? So we really try to do some messaging around, hey, you may have health insurance, but if somebody in your family doesn't, you need to push them in this direction. So we do some of our messaging around moms and grandmas for that reason. And then Claudia was mentioned, you know, partnering with radio, TV, that kind of thing. One of the things that we do every year, because like she mentioned, you know, some of this stuff may be costly, is we develop a 30-second TV commercial and a 30-second radio ad every year. And we call every radio station and every TV station in the state. And we, you know, give them our sob story, and we tell them how important this work is. And we ask them to run it as a PSA for free. And sometimes they're pretty non-committal, but, you know, I always end up seeing it on TV somewhere. So it's always worth asking. All they can do is tell you no, but I guarantee that you'll get some station somewhere to start playing your stuff for free, especially like Mark said, if you've got a good story and you can convince them of why it's so important, you know, more often than not, you'll get somebody to help you out and do that.
I love that. I love that they're non-committal, but then you see yourself on TV and doing this pitch. That is absolutely hilarious. So you all have mentioned media, and we know that that can be costly on folks. I'm curious, what role does social media, which, you know, can be much lower cost, play in your outreach plan? Do you use social media, and have you found it to be effective? Maybe one social channel versus another, or anything like that?
So social media, I think, has become more important as a result of the pandemic. People obviously checking their Facebook or their Instagram accounts a lot more. And I think that's how they're also getting some of their information. And so what we've noticed is with some of our partners, they've definitely been posting more consistently on their social media accounts, putting that a little bit more at the forefront. And then what's interesting is, we've had like stock images that partners have used, and then some of them even took it upon themselves to take pictures of their staff and post those and say like, hey, Anna is here to help you, give us a call, you know. And what's interesting is the pictures of the staff had way more shares, way more interaction than the stock photos. And so, you know, I think it's also because of that human connection element. You know, they're saying, oh, that might be the person that ends up helping me, right? So I would say, yes, social media has definitely become more important, and to make sure that you're sharing your messaging, and then obviously tailoring that messaging.
Yeah, and I'd agree with you 100%, Claudia. Social media has become much more important. It was something that Nick and I were doing on our own before this pandemic started, but we fortunately have a social media guru now that has helped us out quite a bit within legal aid. And we have Instagram, Twitter, Facebook, the usual kind of suspects there. I will say the Instagram is probably the most successful, and Instagram stories have been very successful for us. Countdown clocks to the start of open enrollment, daily countdowns to the end of that massive year-long seeming special enrollment period, with funny gifts from like Schitt's Creek or something like that. Being witty has really been really helpful, because like Jeremy said, this is not the sexiest subject on earth, so making somebody laugh is really helpful. Also, when there and if anybody goes to our Instagram, you'll see, I think it's the handle's NC Navigator, but she lays out color schemes and uses, she's very deliberate at what color she uses and when she uses them. So if somebody scrolls through our page of all the pictures, there are certain things that grab your eye. There are blocks of color. All those things I think have been very important into just getting more eyes onto the posts. But I will say, I think stories are really the way to go, and making them, humorous when you're able to, has really been successful. We have yet to start a TikTok because I refuse to dance or anything on a TikTok. There's only, I'll do some pretty silly things, but nobody wants to see me dance on TikTok.
I think you'd be surprised, Mark. I think you'd be surprised. Jeremy, did social media play a role for you?
Really just to echo what both Claudia and Mark has already said. First off, we have seen the same thing. If we post a picture of an actual navigator doing something, that blows up way more than just a stock photo or a regular post. So we've seen the same thing, and we try to do that whenever we can. And then Mark said, try to be creative and cute. I know a few years ago when Game of Thrones was huge, we did a whole campaign that said open enrollment is coming rather than winter is coming. So the Game of Thrones fans will get that. But, we try to tie it into whatever is culturally relevant at the time too. And that works well. The other thing I'll mention is one of the things that we've done a little differently the last couple of years in terms of our advertising dollars is we've shifted a lot more toward spending our advertising budget on social media ads. So versus some of the TV commercials and radio that we used to do, we'll spend a lot of our funding for advertising on, geofencing or, Instagram ads or Facebook ads or enhanced Google searches. So that's one of the changes that we've done, especially during the pandemic with more people being at home than ever. We've used social media as far as our advertising a lot more too.
That's awesome. That's awesome. And I know we talked about this a bit earlier, that this is an opportunity to really bring people back into the fold of ACA who might feel like they were left out, or even folks who are new and find themselves newly uninsured due to pandemic job loss, all those other types of things. And I think with that comes more education around just health insurance in general. What is a premium? What is a deductible? That health insurance literacy. And so I'm wondering if health insurance literacy education plays a role in any of your programming or your work. If so, kind of to what extent, and are there any strategies around health insurance literacy in the community at all that you all maybe want to uplift?
Yeah, we certainly think health insurance literacy is important, especially when you're dealing with such a large pool of folks that, may not have had insurance in quite a while, or may have never had insurance in their life and don't know how to, make a doctor's appointment or look up doctors in their networks or anything like that. So while during enrollment assistance appointments, we search networks for people who have existing doctors and formularies for their prescription drugs to make sure that we're helping them to find the plan that's right for them and their needs. We also make follow-up calls after the enrollment appointment takes place to ask them, have you made your binder payment? Have you made your first doctor's appointment to, check out some of your free preventative care options? Do you know how to do that? Have you accessed your, for example, Blue Cross Blue Shield account and seen how you can go online and do that? Do you need help with any of this? Because if so, we're a resource to help. And, we can do that Zoom, we can do it in person, we can do whatever makes that person feel comfortable. But we want them to, having health insurance and a card in your wallet is pretty useless if you have no idea what to do with that card. So we want to be there. That's one of the reasons that I say, and I tell everybody that this is not, a seasonal operation where we're just working through the open enrollment period, which I think a lot of people mistakenly think. We're here year round to make sure that we're providing help, not only with folks that have life changes and are able to access SEPs, and appeals and things like that. But we're also here year round to answer questions and making sure that people are using the health insurance that they get. And so I think that health insurance literacy is a critical piece of our work. And the initial way, the way to get in there and do that, I think, and the most efficient way to do that is call those consumers that you've enrolled, and just make sure that they are, making that binder payment and they know how to do those things that I talked about, accessing their networks and things like that. So, and if not, let's figure out a way to educate them and make sure that they feel comfortable with that.
I love that. I love that. Claudia, Jeremy, do y'all have anything to add to that?
I would say, especially in terms of health literacy, you can probably weave it into your outreach as you're meeting with potential partners or champions. I like to call them champions sometimes, because we're all on a mission, right? So, so weaving in those messages about, free preventative services for kids or for women, all those kinds, weaving in some of those short messaging pieces that will help appeal to those partners or those consumers that you're doing outreach to, can be really helpful. And it doesn't have to be, we can all get into the weeds pretty quick, but, I would definitely just stick with some really short pieces to kind of help bring those pieces along with you as you do outreach.
Absolutely. Absolutely.
I don't have too much to add because I think Mark and Claudia pretty much nailed it. We're going to be doing the exact same thing as I think any navigator should. And I'll just say, what I've seen over and over again is when you help somebody enroll and you spend that initial hour and a half even doing their application with them, you really build a bond and a trust with them, and they are much more comfortable continuing to have that conversation with you throughout the year when they have problems with their health insurance. So we just make sure it's clear that, if after they've enrolled with us, they can call us anytime if they're having a struggle understanding their EOB or, really any issue at all. I mean, if their payment's not going through correctly and they don't understand why their company, won't take it or whatever it is, we make sure that we know that they know that we're an advocate for them and their health insurance. So they can always reach out to us and we'll help them through all those pieces throughout the year.
Thank you so much. Yes, you all hear that? All good programs include health insurance literacy. You got to include all of it. So my final question before Q&A, and this is a big one, is in your opinion, you can only have one. In your opinion, what is the single most important resource that contributes to successful outreach? Single most important.
Your people, the people doing the outreach, your people are gold. If they come from the communities that you are serving, you are like in that perfect place. They speak the language, they understand the culture, they know the profile of the community. That is like the most beautiful thing you could have.
Yeah, people. All right, Mark.
I got to echo Claudia with people that have that right message. I mean, there's nothing that can replace that. And there's, we interview folks quite a bit. We're in the process of, offering 9 new navigators positions right now within legal aid. And we go through a lot of folks, and you can just tell the people that are going to be relatable and make consumers feel comfortable. But I want to say one thing before we go is that a tactic that works, and I wanted to do this in the beginning, is intake forms. And I'll make this really short. It's easy lift. You don't have to do a lot of outreach. Get the partners, if they're a clinic or something like that, to slip in a self-selecting form. Yes, I want to be contacted. No, I don't, about my health insurance options on the ACA. Most clinics, most doctors, FQHCs, larger doctors' offices, hospital organizations will slide that in. Health departments will slide that into their intake packet that we all get when we go to the doctor with the clipboard. And that is a really easy and passive way to build a large list of consumers that you can call and chase back into the open enrollment period. And I felt like I'd be remiss if I didn't say that. So I just wanted to add that in.
Thank you. That was two things, but it was really good. So I'll let it slide.
Okay.
All right, Jeremy.
Yeah, I mean, I've got to agree with Claudia and Mark, but I don't want to say the exact same thing they will. So I'll also just say that your partners wholeheartedly believing in your mission it was what I would say. If they trust you and they know what you're all about and the help that you're providing, they're constantly going to be sending referrals your way. They're going to be inviting you to all of their events. They're going to be standing there waiting and bringing their friend over to you and saying, hey, you guys need to link up because this person needs help. So, a complete trust that your partners have for you, that makes a huge difference in getting out there into the community and doing the outreach that you need.
Yes. All right. People and partners. If you got those two things, you're good to go. Oh my gosh. Thank y'all so much. I know if we were in person, everyone would be applauding, and snapping, and doing all the fun things. I'm going to hand it over to you, Mina, to read out any questions that we might have from the group. Hopefully, if you can hear me, Mina.
Yep. I'm scrolling through. Again, if you want to ask a question, put it in the chat box, or you can raise your hand and we'll unmute you. Let me see here. So there's a comment here, and maybe you guys can speak to this a little bit more. There's going to be an issue maybe going forward with the new SEP for people under 150%. Are you guys going to be doing outreach about that?
Yeah, I think we certainly will. Again, I think we have to combine that again with that sense of urgency message. So we have to kind of weigh those out, and because in the grand scheme of things, while we deal with primarily consumers with between 100 and 250% of FPL, there's a smaller portion of people that would be able to access that SEP. So while we do want to make sure to get that message out, we have to do it very smartly and very targeted, so as not to muddy that urgency message that I think is really critical to reinsert into our talking points.
Awesome. And then I have a question for Jeremy that I got my direct message. So thank you for this person. It says, I have a question for Jeremy. Can his navigators become certified in multiple states, or are there navigators assigned to work specific states?
So in the past, we did have certain salaried members of our staff and some of the shift supervisors that was certified across the different states. And, myself included, I was certified in all 4 states, and I would help, anybody that needed it. Moving forward, we've got enough staff and capacity that each program is going to have their own navigator just for that line. So other than myself, I'll still certify in all of them so I can help everybody. But yeah, in the past, just with the funding restrictions, we kind of just all became certified and helped. But moving forward, we'll have dedicated people on each state.
Right. And this is another question for you, Jeremy, and I assume it's probably yes, but is there a script example you use for your phone lines to have an idea of how to start the conversation?
No, not really. I mean, that's been one of the differences between ours and like healthcare.gov. I feel like if you call the federal marketplace, I don't know. I mean, if sometimes you don't feel like you're talking to a person, they're just reading a script and, it doesn't feel personal. We largely do our phone enrollments just like we would if we sit down with a person. So, we have certain screener questions, of course we ask, are you married? Do you have kids you claim on your taxes? Are you offered coverage through an employer? We do some of those screener questions, and then we just kind of see where the conversation leads us, just like we would if we was sitting down with that person face to face.
Oh, awesome. Okay. So it's like some screener questions, but treating it like you would and building that relationship on the phone.
Yeah, definitely.
That's awesome. That's awesome. Mina, are you getting any other questions that are coming in?
Yeah, there's another one in here. Maybe Claudia, you can answer this one. Can someone that is not signed up in the marketplace and has a life event change or has a life change in, for example, April, some other time of the year outside of open enrollment, can they enroll in marketplace coverage?
Okay, can you repeat that again?
Sure. So if it's outside of open enrollment and someone has a life change, can they sign up for marketplace coverage?
So if you have a life-changing event, it would have to fall within one of the approved SEP categories. So that's really the key here. It has to be in one of the ones that are approved. So, so they could definitely connect with a navigator, and the navigator would definitely guide them to see if they fall within one of those approved categories.
We want to make sure they do it within 60 days of that life event, or else they're not going to be able to access it at all. Yeah.
Yeah. So don't make sure they don't wait. And, the minute it happens, definitely check in with the navigator.
Yeah. And it looks like the question was, it happened in April. So so it looks like maybe not. I don't know.
Yeah. It would depend the timing of the event.
Mm-hmm.
And then if it falls within the bucket, that's approved.
All right, y'all. Any other questions? Pop them in the chat.
Yep, we have another question here. For the new navigators that are coming aboard, outside of the CMS trainings, maybe the regular ones that they go through, what are some other resources that they can use to kind of gain confidence and knowledge going forward in this work?
CVP, go ahead.
Oh, I'm sorry. Okay, so something that they can do is, so they can always, I say peer-to-peer support is super important. So if they can connect with maybe a more seasoned navigator to kind of talk to, if they can shadow with them, spend some time with them, that's obviously awesome, but you have to take in consideration we're in a pandemic, so that might look a little bit different. One thing that Arizona does is, under the auspice of our coalition Cover Arizona, we do yearly trainings for all of the navigators, CACs, and assisters in their state. And so we help provide, we have speakers come in, we have our Medicaid representative come in, we have CMS come in, we even do scenarios of the most common situations that you might see in your world of work. And so those are just some of the things that we do to kind of help continue to engage, have the navigators continuing to learn and engage.
And I'll say anybody that's done the CMS certification and navigator training knows that that's not nearly enough to really let you, to really give you everything you need to go out and be a navigator. So we have North Carolina specific trainings. We ask folks to join the CBPP webinars, Young Invincibles webinars, different groups that provide really critical information and tactics through their webinars. We make sure that a lot of those are mandatory for our staff. And we also, like Claudia said, do an assister training that is for everybody, CACs, navigators, whatever the case may be. We're in the process of planning that right now. I think it's sometime in October, mid-October. That's something that we do year in and year out. And we also do that connection from navigator to navigator. And I think Shelley said it here, CBPP webinars should be mandatory for all enrollment assisters. They put on incredible webinar series, and they really provide some excellent information on those webinars. So finding those mandatories and making them, or finding those webinars and making them mandatory, or at least viewing the recording mandatory, I think goes a long way to getting people better prepared, because like I said, that CMS certification training is just not enough to really make you go out there and hit it full speed ahead.
Yeah, I'll also, if nobody's mentioned it, also CMS, I mean, they'll do their weekly Wednesday webinars, and most of those are archived. And so I've had my folks go back and hit up all those old CMS-led webinars. And then, you know, we've been doing some role play with some of our new navigators. So somebody will sit on the other side of them and give them scenarios and act like they're enrolling. And then Georgetown University, they release a navigator guide every year. It's got some good information in it. And then one of the new things that we started doing, just because we're all so used to Zoom nowadays, is I realized that I can just record myself doing things on Zoom. So we've made small little videos of this is what it looks like to create an account on healthcare.gov. And we shared our screen, and I recorded it on Zoom, and then we have them all watch that anytime they need a refresher on how to create an account. And then same with, you know, doing the application, or we did little videos on this is how you search for providers, or this is how you search to make sure medicines are covered. So we did these little Zoom snippet videos for each subject that somebody can go back and rewatch just to make sure that they're up to speed on that topic.
Awesome. I think we have time for maybe one more.
Yes, definitely. Let me see. Oh, I see one here. Claudia, do you know of any Spanish language resources for enrollment that are specifically geared towards the Latinx population?
I would definitely check out any publications through CMS, any marketplace resources that also have Spanish. I will say we use those resources, but also our partners also translate things themselves. So as they develop flyers or social media, you know, a lot of them do their own translation. We've also, and even through the coalition, we've done our own translation. So it's kind of a mix. So you can certainly use some of what's already available through CMS and Marketplace, specifically in Spanish. But then there are some very specific examples through partners. So, but I can also put my email in the chat in case you want to reach out, and I can certainly have a deeper conversation.
Yes, please do that. Okay, are there any more?
I think that's all the questions we have, Aurora.
Oh, wow. This was so fun. It was so amazing being able to talk to the three of you. Y'all are just incredible experts, wonderful sources of knowledge, and just incredible humans. All of you on the call, thank you so much for listening. I hope you took some gold. I took a lot away from this conversation and thinking about what you're going to do moving forward. I know this is going to be an incredible open enrollment session for all of us, and I just can't thank the three of you enough for sharing all your knowledge and expertise with us. Thank you all so much.